Hi, I'm here with Dr. John Bellatti and wanted to talk with him today about why he's leaving Hawaii. He's been here for over 2 decades helping the people of Hawaii, and now he's leaving. And Dr. Bellatti, can you please tell us a little bit about yourself and why you're leaving?
I actually moved to Kona immediately after finishing training at Queens Hospital. I expected to stay there the rest of my life. I've been practicing there for 21 years in orthopedics. The situation for practice in Hawaii in general has been deteriorating. The number one feature of that is low reimbursements, particularly when you compare to the mainland. A secondary feature is the lack of tort reform, which in many ways affects doctors.
So what exactly in terms of tort reform are you talking about? What's the issue?
The real issue is the strain that it places on doctors, both in concerns when you're meeting a patient, particularly in an emergency situation, and if a complaint really is filed, that adds anxiety to your life, time off practice, working on information which you otherwise wouldn't need to know. There's also a tremendous strain on our system with unnecessary tests and other activities to avoid the complaint of delay in diagnosis. That would be primarily in emergency situations. And if you've been to a hospital emergency room and had to wait a long time, it's very likely that you have been affected by the need for doctors to cover themselves against such malpractice complaints.
So in Kona, there's not a lot of orthopedic surgeons.
No, there have been two in the last year full-time. Next year, after January, there will be none. I looked at my records and found that in the last year I saw 1,000 different people. I've talked to the other doctors, and I would suspect that about 4,000 patients, different people, saw the three orthopedists in the last year. Next year, those same people or ones like them will need orthopedists, and there will be 4,000 people that can't find one there.
So do they need to leave the island, or how will that work?
When the care is emergent enough, they'll leave the emergency room by air ambulance to be flown probably over to Queens. If they have less difficult problems, they may still have to fly all the way to Honolulu or Maui to get treated. This would include a 5-year-old with a displaced wrist fracture. No one else can put it back but an orthopedic surgeon, and there will not be one there.
How did it get this serious without the legislature addressing the situation?
Well, I think there have been some deaf legislators. We have been announcing that this would happen starting about 5 years ago. I was very vocal about 2 years ago, and for a while, pointing out that there were going to be a loss of doctors on the outer islands first, and then it will spread to Oahu.
And so at the point of, how many orthopedic surgeons are there left in Hawaii? I mean, people have to come from the Big Island and come over here. Is that right?
I don't know the number, and it's a little bit hard to figure, but many of the orthopedic surgeons here on Oahu are not taking emergency call. I think that the biggest problem for people is going to be emergency situations. We have, I believe, only one pediatric orthopedic surgeon. He can't cover all the children who come from the outer islands when they're unable to find care.
So for you personally, what does this mean for you, and how is this impacting your life?
Well, it is a big change. I had expected to retire in Kona after working there as long as I wanted. I think you can't work in Kona and retire in Kona. You won't make it. Moving to the mainland disrupts my family. I will probably at first become a commuter, going over to the mainland once a month to work for a while and then come back.
Okay, any final thoughts that you want to say to the legislature or to your patients or anybody else?
Well, I think all of the legislature needs to take up the interests of patients. There are problems with reimbursement, and there are problems with tort reform, and there are problems with the business environment for medicine. And someone has to, at the legislative level, has to take an interest in this and champion it, in addition to Josh Green, who is already doing that.
All right, well, I'm sure that your patients will miss you, and thank you for your service to Hawaii, and good luck in your new venture.
Thank you.